Someone drilled this hole into a living human skull. Look at the edge. It's smooth, rounded, healed over. That kind of regrowth only happens if the person kept living for months, maybe years, after the cut. This wasn't a fatal wound. This person survived it. This is trepanation, deliberately cutting or removing a piece of skull bone from a living patient. It's one of the oldest known surgical procedures on Earth, practiced for at least 7,000 years, on every inhabited continent. And it's not the same thing as an accidental fracture. A fracture is jagged, radiating, uncontrolled, the mark of a blow or a fall. A trepanation opening is deliberate, a clean, bounded shape, cut on purpose, not caused by force. So how did prehistoric surgeons actually do this, with no metal, no anesthetic, and Stone Age tools? The archaeological evidence points to three methods: scraping, wearing the bone away layer by layer with a sharp-edged stone tool, slow but controllable; cutting, incising a shape, often a rough square, and lifting it free once the cuts meet; and drilling, boring a ring of small holes close together, then connecting them to remove the bone between. Tools were whatever was locally available: sharpened obsidian and flint blades in the Americas, later bronze and iron instruments elsewhere. Experimental archaeologists, replicating these methods on donated bone, suggest the scraping technique alone could take 30 minutes to an hour of continuous work on a fully conscious patient. Here's how we actually know people survived this, and it's written in the bone itself. An unhealed opening has sharp, ragged, unremodeled edges. That person died during the procedure or shortly after. A healed opening looks completely different. The edge is smoothed and rounded, with new bone grown back across the gap. That kind of regrowth is not possible without a living, functioning body doing the healing for a real stretch of time afterward. So why would anyone cut into a living skull in the first place? Many openings sit right beside an old, healed fracture, consistent with treating a head injury or relieving pressure inside the skull. But some trepanned skulls show no sign of injury at all, which is why researchers also consider ritual or spiritual explanations. Nobody knows for certain which explanation fits which case, and archaeologists are upfront that a single universal answer probably doesn't exist. We do not know how pain was controlled. What the bone proves beyond doubt is this: prehistoric skull surgery, done with Stone Age tools, though we do not know how pain was controlled, was not automatically fatal. Some patients lived long enough, healed enough, for their own body to close the wound.